Little kids eat paste, but nobody eats the Medicare for the Lazy Man podcast. The Medicare podcast with a heart of gold. Trying to cram 10 pounds of Medicare into a 5-pound bag, it's Medicare expert Doug Jones.
Hello, everybody. Welcome to another episode of the Medicare for the Lazy Man podcast. Welcome to all. We are so happy to have you with us today. It's a beautiful sunny day in Arizona, and this just makes me even happier to be able to pontificate about Medicare and all the advantages of the plans I think you should be looking for, Medicare plus a Medicare supplement. But enough about that. We can talk about that later on. In the typical course of business, when I try to talk to people about Medicare, I'm always hopeful that they have read my book, Medicare for the Lazy Man 2026, because that means that when we discuss their Medicare options, they're going to have a very clear understanding of what options exist and why I have certain recommendations, why I anticipate a much better outcome for certain selections than I would for other selections. There aren't many decisions that are this important in Medicare, only a couple of decisions, but it's important to feel comfortable that you're making the right decision, and that's what I try to help people do with my books. Medicare for the Lazy Man 2026 is the flagship of the fleet. It's the one that's most valuable to the new Medicare participant because it helps understanding and comprehension of the whole morass of, it's a government program. It wasn't really designed to be easily understood as a product of a lot of compromises. So I always suggest that people starting to learn about Medicare, go to Amazon.com and select Medicare for the Lazy Man 2026. Now, you can get it in paperback for about $11. You can get it in Kindle version for about $5. You can get it in the Audible version. You can just listen to it. Now, talk about being lazy, but if you want somebody to read that book to you, we can arrange to have that done. And then, of course, I have mentioned that the hardcover version is the most impressive format of Medicare for the Lazy Man 2026. It is a $25 item, but it's the kind of thing that provides permanent Medicare educational sharing of knowledge with you forever and ever and for succeeding generations. I mean, once you put that in your family library, it's there to stay. It's not going to fall apart like some paperback's going to do in a couple of generations. I also have the suggestion that if you have, if you're inclined to be a generous donor to, say, your local library, you might want to purchase a couple of editions of Medicare for the Lazy Man 2026 in hardcover form and then donate them to your local library. I'm sure there are people, library patrons, that may not be able to afford their own copy of Medicare for the Lazy Man, and they would appreciate being able to borrow one from the library. And I'm sure the library would appreciate having the additional reasons for patrons to come in and peruse the books on their shelves. In any event, that's the primary Medicare book. Now, when it comes to enrollment in Medicare, I've synopsized I boiled down the information about the enrollment process into a much smaller, shorter book called Medicare Enrollment Guide. Now, that book is available for sale on Amazon.com, but you know something? It's full of knowledge that's valuable, and it would be unfair of me to try to make a profit from that particular type of knowledge. It's something that everybody's going to need. I would rather that you go to my website, MedicareForTheLazyMan.com, and download it. You can just click on the link, and you can put it into your computer or your phone or whatever you have, and you can read it right there. It'll be yours to keep free of charge, and you don't even have to fill in your email address in a questionnaire. That's how much I want to get this book out there in the hands of everybody who might possibly have a need for the knowledge, and that knowledge is how to enroll in Medicare. Lately, we've been reading a chapter an episode, and those chapters are very short, and the whole book is very short. It is not going to be taxing at all, but it will be valuable knowledge to have when your enrollment time comes. So, the third book, Medicare Drug Plans, a simple DIY guide. That is also available for you. A lot of people are having difficulty with agents not wanting to help them choose the best drug plan. These agents will either decide that they can't afford to spend that much time helping people pick out a plan that they're not going to earn any commission from, or they steer them to inappropriate plans. There are one or two inappropriate or plans that are inappropriate for most people that still pay a small agent's commission. And some of these people will do pull an unfair trick on their clients and send them to the one or two plans that pay commissions in the area in question. So I, on the other hand, tell people the thing you want to do, you want to find the best drug plan for you, and the best drug plan for you is always the cheapest drug plan that accommodates your purchases at your preferred pharmacy. So that's the criteria. You can try to find some agent that's willing to, perform that function for free all day long, or you can purchase my book. And that book is Medicare Drug Plans, a simple DIY guide, and it leads you by the hand through the government website to help you understand and select your preferred drug plan. And at the end of the book, you'll find the step-by-step instructions as to how to enroll in your drug plan once you have selected the proper drug plan that's going to be best for you. This is a process that should be repeated every year because those drug plans have a possibility of turning on you like a rabid dog. I've got a couple of clients that woke up in 2026 and found out that their drug plan had cost them a small amount of money a couple of years ago, was now over $100 a month. And once you're stuck, you can't get out easily. So I would say that it's a kind of thing that you want to do regularly. And if you have a very challenging drug regimen, or you have to take a lot of drugs and it's really confusing, then I've got links in the Medicare Enrollment Guide to an excellent computer-driven resource that will be a more sophisticated drug plan selection opportunity for you. So it is, there are other options out there, but if your drug needs are not that challenging, then I would suggest purchasing Drug Plans, a simple DIY guide, learning how to do it yourself on the government website, and you will find that you've picked out an excellent plan and you're not going to be spending a lot of money on it, and you'll be able to do it for yourself every fall at what people call open enrollment. Speaking of what people call things, I'm calling my engineer Randy Carson because theoretically that's his name. If he has a different name, he's never told me, but
I'm from Nebraska, and I'm in the witness protection program.
That's what I knew. There was some kind of undercurrent of mystery going on. I've never heard the whole story.
I've kept it, I kept it away from you for all these years, but someday I'll give you the whole story.
That's going to be the kind of thing we can do over a Guinness, I would say.
Yeah, absolutely. We're obviously I'm going to let people know that we don't publish these things the day we do them. We're off schedule just a little bit, but bottom line is St. Patrick's Day is coming shortly.
Yeah, what day is that going to be?
It's actually today.
Oh, for some reason I was thinking it was the 21st. I thought it was.
No, it's the 17th.
Okay.
So anyway, we've been wringing our hands trying to find sources of Guinness, and the bottom line is we just got notice from all of our trusted suppliers the one that claimed to have some just called up and said they got lost and couldn't find our house.
Did they
So,
sound like they were sober?
may, may, maybe they've been dabbling in the
Gee,
merchandise.
I would be if I were them.
So anyway, here you go. I just wanted to let people know that it's 88 degrees out here, and I was talking to my family back in Nebraska over the weekend, and they were in the middle of a blizzard, so they said, "Oh, it's like in the high 20s, low 30s, somewhere in there." And so then I go, "Oh, I won't bother telling you what it is out here." And I said, "Yeah, it's in 82 degrees." And I won't bother to tell you all the names they called me.
Well, I'm kind of went through the same thing myself. We had my sister, who is Drew McMillan's mother, brought her 7 of her tennis playing posse down from Toronto, and they've been hanging around in the Southwest for the last few days, watching various sporting events, and finally they came over to Cave Creek, and one of the women who actually has a house near here in Terra Vita said to me, boy, I said, isn't this weather magnificent? Thinking that she was one of the Canadians, because I frankly don't know their names, and I need to know them better before I can be more appropriate with my remarks. So I said, what fantastic weather, huh? And she said, well, I'm not really a refugee. I'm the one that lives in Terra Vita part of the time. And I said, well, do you like the weather? Are you happy that you purchased? And she said, I am, but I'm horrified because it's going to be 37 degrees in a couple of days. That's just disgusting. That's horrible. That's frightening. And I'm thinking to myself, 37 degrees.
37 degrees, where was that at?
Well, it turns out that she was thinking in terms of Celsius, and I was thinking in terms of Fahrenheit, and I was really confused.
I'm going 37 degrees Fahrenheit.
Yeah,
You
what are
and
you
I
talking
would
about, lady?
you would find me laying in my driveway, frozen stiff like a fish.
Man, I'd be packing my bags and I'd be out of here in no time flat. But as it turns out, she was thinking in terms of Celsius. I think that translates to a temperature over 100 degrees.
Yeah, 37 Celsius is a pretty heavy duty, warm day.
I don't think she has anything to worry about in Cave Creek because we're kind of up, I'm halfway up the Nosebleed Mountain, so it never gets
Yes.
as hot as it does in Phoenix. But
Yeah, yeah.
it was fun having them here. They were all wearing matching Indian Wells tennis T-shirts. I think they were here for some sort of sporting event, but I don't know if it was tennis or golf. But they then came over here to Arizona, and they went line dancing at Harold's one night. And then Sunday, I gathered with a small collection of people from Illinois who the weather, they were fascinated by the fact that they didn't have to put up with all the snow that had hit Illinois
Oh
over the
yeah,
weekend.
yeah. So did all these ladies with their line dancing contest or their classes or whatever they were doing, did they all have the appropriate clothing like boots and hats?
Well, I asked my sister why each one of them had a bandana on, and she said that was their nod to Western wear for the line dancing activities.
So this was a neckerchief?
Yeah, yeah, yeah. They each had a neckerchief, and I thought, my God, what am I looking at here? Because they're all wearing Indian Wells T-shirts, Indian Wells Tennis Club T-shirts.
Oh, this is so disgusting. They had neckerchiefs?
Yes, they did. Yes, they did.
Oh
Well,
my God.
remember they're Canadian, so I'm not
They're
sure they actually.
Okay. I have to remember that they're Canadians, and they say things like "yeah,"
Yes, and
and
boot the hoose and stuff like that.
yeah, and then they say "excuse me" for everything, or "I'm sorry" for everything, whether it's their problem or not.
Yeah, we're told they're very nice. In fact, I believe there's some Canadians that aren't so nice, but that's not this crowd. They're a bunch of
Yeah,
very nice people. It was
yeah.
wonderful to have them hang around, and I had to help pose them for pictures and all that stuff. And I did kind of break down and say, this is every adolescent's dream to be surrounded by a whole bunch of women. So it
Well,
was
yeah.
it was a fun few hours, and then they were off to line dancing at Harold's, and God knows where they went after that.
There you go. Well, you know something? I think we need to make some money here, so
Well, if it's possible to do that, I'm going to give it the old college try, and I'm going to start out with a Medicare Advantage Minute, which is the segment of every episode in which I try to warn people about the dangers of Medicare Advantage. It's entirely possible that a person who signs up for a Medicare Advantage plan becomes trapped forever in that plan until the plan abandons them. And the reason for that is if your health goes south on you, you could very well wind up without any options to change, because the best option for you would require that you answer health questions in a manner that's satisfactory to the underwriters. And those underwriters are not allowed to ask you any health questions if you enroll in a Medicare supplement at the right time. So, going back to the premise of our segment, it's Medicare Advantage Minute. And the headline here is a report states that Medicare Advantage waste has cost seniors $82 billion over the past decade. Now, I'm not surprised to hear this, but sometimes other people are. So, deceptive billing practices from big insurance companies may be driving up costs for all seniors. You know, some other articles we've read have changed from senior to retiree. So maybe I'll just substitute the word retiree. So the insurance companies have deceptive billing practices, and they may be driving up the costs for all retirees on Medicare, according to a new report from the Congressional Joint Economic Committee. The report specifically examined billing practices for Medicare Advantage, the the private insurance alternative to traditional Medicare, which is used by tens of millions of seniors. Retirees. The report does not dispute that the program provides valuable benefits, including dental, vision, hearing coverage, and prescription drug plans, but it raises concerns that that certain payment practices within the system may be forcing retirees to pay more out of pocket for care. About 55% of Medicare participants are now enrolled in Medicare Advantage plans, reflecting the program's popularity. But the report eliminates the Medicare Advantage payments, estimates that the Medicare Advantage payments average roughly 120% of what it would cost to cover the same people under traditional Medicare in 2025, resulting in an estimated $84 billion additional funding amount. Because Medicare Part B premiums are tied to program costs, those higher payments can ripple outward and affect all Medicare participants. According to the report, Medicare Advantage overpayments increased Part B premiums by about $212 per enrollee. Now, that's an annual figure, totaling $13.4 billion in higher premiums nationwide. Over the past decade, the cumulative effect has been even larger. Since 2016, these additional costs have added an estimated $82 billion to Part B premiums, meaning that retirees and taxpayers alike have borne the financial impact. For some families, the added cost could be even higher, potentially hundreds of dollars extra each year due to inefficiencies in the system. And these costs could grow, of course, in the years ahead if reforms are not implemented. Well, I don't know. It seems as though, from an article I read in the last episode, that some of the reforms are starting to take hold. And the biggest reform is the fact that the government has reduced the payment that they're going to be using to support the Medicare Advantage plans. It was kind of a trade-off when these things were established. It was basically an idea that Medicare Advantage plans would promise to provide care equivalent to that of Medicare for all enrollees without regard to their health status and without regard to their ability to pay. But what happened? The companies found a way to milk the system, and therefore the government now is writing big fat checks for each participant in a Medicare Advantage plan. And where is that money going? Well, some of it is going to agents in the form of very high sales commissions, and the rest of it is, the rest of it's kind of a mystery. Randy has a thought here. I'm always enjoying his
Every
thoughts.
once in a while, I have a thought, and you know While you were discussing that, it popped into my head. Have you ever heard of the show Are You Smarter Than a Fifth Grader?
I am, and I never have been, but I'm
So I've got a question. Let's pretend that I'm a fifth grader.
all right. That's not too hard to do.
Why? Yeah, exactly. I know that. Why would we be paying for a program like Medicare Advantage that actually costs the country more money than if we went back the old way?
I'm sure it was a
Why?
bunch of steps.
Why
I'm
is
sure
that?
I'm sure it was a bunch of compromises, and as the insurance companies altruistically trotted out their plans many decades ago when they were brand new, they thought, oh, there's a way we can actually turn this to our advantage. But what happens is the government did, well, they should have done what I suggested in my book. I think I've still got my suggestion in the book. The government shouldn't have started a big giant Medicare department that is just it's got 1 million employees and we're paying for them. And what they should have done is just sent a check to every retiree, every senior, every person that qualifies for Medicare, and allow them to purchase their own insurance. And we will then reimburse them for the difference in cost, because health insurance costs more for older people than it does for younger people. And the only reason Medicare exists is because they complained years ago that the insurance was becoming unaffordable for older people, especially those who retired. So the government said, we're going to start Medicare, but they did it in a way that was just so goddamn expensive that it's incredible, the budget they have, and it grows every year. And then somewhere along the line, Medicare Advantage plans were created, and they were supposed to cheapen things up because they were going to take over many of the functions, and the government was just going to write them a check for each participant. And I can see Randy's eyelids are getting heavy. They're drooping because a little Medicare talk is enough for most people. But it just got out of control. The whole program became a giant sump, and now it costs more for a Medicare Advantage enrollee than it does for a regular Medicare enrollee, even though they are too expensive.
And correct me if I'm wrong, but ultimately, if you had a Medicare Part A and B and a supplement, we know what that's all about.
Right, right.
But if you have a Medicare Advantage program,
Uh-huh.
by all rights, you pay more for that. The government pays more for it, and you get less than the other way around. Now, am I missing something, or what am I missing here,
Yes,
Doug?
because they're telling you that you're going to get more for paying less.
But they're
telling you
lying. They're lying.
it doesn't work out that way, but it's unfortunately one of these deals where we're all being promised a wonderful Christmas, and then when we open our presents, it's all underwear and socks and handkerchiefs from Aunt
Yeah.
Mildred or whatever.
Or it's that pink bunny suit.
Yeah, it's not anything that we really wanted for Christmas. But by the time some people find out, some people are healthy and they never have a problem with Medicare Advantage plans. Some people have problems, but they don't know that there is a much better alternative. And some people try to get out and are unable to do that, except in certain states and in certain circumstances. So it's frankly the kind of thing where not everybody has a problem, but once there is a problem, it becomes very difficult, if not impossible, to fix.
Well, I used to play tennis quite a bit. There's a point in the scoring in tennis called advantage so and so.
Yes, yes.
Okay. Medicare Advantage is advantage not
Yeah, it's
the
it's
patient.
love. In tennis parlance, it's love. Advantage.
Yes, you got it. You got it. Well, anyway, I'm going to go ahead and mute out and let us go ahead and make
All
some
right.
more money here.
But be
I
sure.
can hear it rolling in as we speak.
Oh yeah, I'm sure that's happening. But what you should do is give me the high sign when we're getting close to wanting to quit, because I forgot to set my timer at the appropriate time, and I've got 10 minits now, and I know that
You have 5 minutes and 24 seconds.
okay, that's good. I'm going to remember that number and add it to what's there. Alrighty. Uh, I got another little hint, another email from one of my favorite insurance companies, Mutual of Omaha. One of the things they do that's unlike any other insurance company that I deal with is they tell me when my clients are going to have a rate increase. And that allows me to go to my clients that didn't follow my advice to purchase high deductible plan G and to entice them, to say to them, look at the rate increase you're going to get. And would you like to reconsider what my suggestion was, which is to purchase high deductible plan G? And if there's a way to allow them to get that change, then I will help them do that. If they don't care, then that's fine with me because I make more money the more they have to pay. I would just prefer that they pay less money so that they're always going to be happy to be my clients. But here is the way that I can illustrate to you, the person who may not have enrolled in Medicare yet, the fact that Plan G is a magnificent plan that covers almost everything, but it's just too expensive and it's going to continue to get expensive. In this document, I have 5 different clients. 2 of them have Plan G. The 2 people that have Plan G are getting $50 rate increases. They're going from around $200 to over $250. At the percentage is 24% increase for one of them and 24.7% increase for the other. That makes their Plan Gs that much more expensive. The 3 people who have high deductible Plan G, 2 of them are getting 7% increases. And their increases are $3.31, and the other one is $2.34. Now, there's one outlier here that is getting a huge percentage increase, just like the ones on Plan G. This person has high deductible Plan G, but they're getting a 23% rate increase. But the dollars tell the tale. Their rate increase in terms of their actual expense is not $50 a month like the other Plan G rate increases. It's $11.63. So they've got a high deductible Plan G. They got a 23% rate increase, but that translated to fewer dollars than the same percentage rate increase would have if they had Plan G, for which they were paying a lot more money. So I'm going to be looking at the files for the 2 clients here that are getting $50 per month rate increases, and I'm going to be asking them if they want to consider changing to a high deductible Plan G, which is going to be a lot more cost effective. And then finally, we have a little article here. The government wants seniors to use AI for care navigation. Now, I haven't read this yet. It sounds kind of interesting, though. The government agency, CMS, plans to introduce artificial intelligence agents to help Medicare beneficiaries find doctors and health plans, a challenge given many enrollees don't yet trust the tools. This is apparently Dr. Oz brainstorm. The CMS, the government, wants to deploy artificial intelligence tools to Medicare participants to help navigate their care. The agency is already using the technology to detect fraud, but the government also hopes to get the technology into patients' hands, both to assist them and to hopefully bring down rising healthcare spending, which continues to outpace the rest of the economy. The fundamental problem right now is that other sectors of the U.S. economy have advanced and have been deflationary with their use of technology. Healthcare has remained inflationary. The federal government wants to introduce artificial intelligence systems that can act more autonomously to Medicare beneficiaries to help them find doctors or to choose Medicare Advantage plans. Well, that sucks. They should be getting out of Medicare Advantage plans. That's what artificial intelligence should be helping them do. That tool should be available by the time we're finished with this administration. The biggest challenge is that Medicare beneficiaries don't trust AI, Dr. Oz noted. Only 31% of Medicare enrollees aged 65 and older trust AI a great deal or a fair amount to access medical records and to provide personalized health advice, according to a survey published by KFF. I don't particularly trust KFF, much less anything they might publish. No one has gotten to them with the use case of why it'll transform their life for the better. It seems like a tool that we use to market to them or to help hospitals deal with issues, but not necessarily their issues. I think he means problems. That's the word I would use. So get ready for Dr. Oz to be touting the benefits of artificial intelligence. And then I've been saving this for Randy. And since we're a little on the late side, I won't spend a lot of time on it. But Randy and I talk periodically about things that irritate us about permutations in the English language. We're both kind of traditionalists when it comes to the use of the English language. I have a list of things that irritate me that people have said, and Randy has mentioned several things that irritate him, notably the use of silver in silver sneakers or silver this or silver that as meaning only for old people. In fact, his face is looking at me like, what are you talking about, Willis? That's a very
What are you talking about, Willis?
Yeah, exactly right. So here's an article I ran across that I just could not pass up. The headline is Leverage, Reach Out, Circle Back. The corporate jargon we hate the most.
Run it up the flagpole. It's not in my wheelhouse. Oh my God. I could do that. I could do this for headwinds. I could do, oh my God, footprint. I could do this for days.
I knew you'd appreciate this. So whoever this is says, we pinged our readers for the terms that really annoy them. The list is long, it says. Okay. I'm just going to read the list here. I'm not going to do all the editorializing. Bandwidth, change agent. Let's see here. Circle back. We touched on that. Decision tree. Decisioning. Now, that's a new one on me. I haven't heard that term. But you don't make a decision. You have a decisioning process, apparently.
Yes, you do.
Deep dive. There's one.
Deep dive. Yes. Yeah, absolutely. Headwinds. Yes.
Growth mindset.
Yes.
And hard stop. I don't like when anybody says hard stop. I don't stop.
Well, you know where that comes. You know where that comes from.
Where's that?
That's actually a European comment. You know, if you're going along spelling something, blah 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 blah, and instead of saying period,
yes,
they say hard stop.
Is that because they don't have periods in Europe?
I don't know.
Maybe they should get some if they want to speak.
Maybe they should get. Periods are really pretty cheap. I could send them a whole box of them if they need them.
And frankly, you can use periods all day long and not use up any resources that aren't renewable.
Yeah, now periods are even less money than commas.
Well, I'll tell you. Okay, here's the last one in this article: hit the ground running.
Oh, for God's sake!
Now you and I could spend a half an hour and add volumes to that article. I just wanted to share that with you. The other thing that is, I did research on it, and AI told me the exact source. It is people saying, "I appreciate you," instead of "I appreciate it." In other words, when I do a favor for somebody, they normally, all of my very lengthy life, have told me, "Oh, I appreciate you. I appreciate it. Thank you for doing that. I appreciate your effort. I appreciate what you did for me. Thanks a lot." But lately, just the last couple of years, it's turned into "I appreciate you." And I don't like that because it's not traditional, but it's probably the least harmful of the changes that we could be complaining about. But it came from Ted Lasso.
Who's that?
Well, if you have to Google it, I guess. Ted Lasso is a series. It's a not a network, but a cable TV series about I think a soccer coach or a football coach who winds up in England teaching people. I guess it must be our American football. He's teaching people in England how to play it, I think, is the premise of the show. But that's the pinpoint beginning of that particular change in the English that we speak. And so I just thought it was interesting we were able to actually find the source, because I noticed years ago people saying, oh boy, I can't remember the phrase now. A lot of people started saying this stuff, including people older than me. And I asked them where they got that. And they said, I don't know. I have no idea.
Ted Lasso.
No, it turns out it was an Aussie phrase. So they all must have watched the same movie.
Oh, yeah.
I can't remember now what it was, but it's something that people use way too frequently. And I just knew you'd appreciate this article that I just shared with you.
The other thing that absolutely irritates me because it shows me that people don't value themselves sometimes. And
Uh,
what it is that when I was in the banking business many decades ago, one of my jobs was to hire and interview technical people. And if I got a resume where they didn't even bother to capitalize their own name,
yeah.
I just threw it in the garbage right then.
Well, I don't blame you. And what about telephone numbers? We
Yeah,
have parentheses and dashes for a reason. They're for
yeah.
telephone numbers.
Or
You
they could
don't
all
put
be run together, like they don't even bother knowing where the
exactly,
parentheses are.
exactly. We could go on and on. Maybe this should be the subject of our second podcast. We do two new
Yeah,
podcasts every day.
the the things that Doug and Randy don't like.
Exactly. And we can just, make a list every day. And I wouldn't mind doing that. Get your poop together, people.
Yeah, or yeah.
Well, I think it's probably time for us to sneak out of here before we irritate the audience to the extent that we're not going to have an audience anymore.
Well, you know something, folks? Grab your pencil, your number two pencil, if you have one, because this is really important. We're going to make you color in some dots. No, we're not. I'm just teasing.
That
So
sounds
here we
like
go.
fun.
DBJ at mlmmailbag.com. That's where you can write to Doug any time of the day or night to ask him a question or make a comment. He monitors that email box all the time, 24/7. I think he even stays awake at night waiting for the mail to arrive. So,
I do get excited about the small things in life.
I know, I know. So the other thing I want to mention to you, and don't forget this because it's really important. Doug is licensed in every state of the union to help you with your Medicare supplement planning, and I would certainly take advantage of that. MedicareForTheLazyMan.com, that's where it's all happening on the web. Number three, if you could drop a review for us somewhere on the web as you're wandering around, to keep us ahead of the travel log people. I would certainly appreciate it. Last, thank you. We don't say it enough. Thank you for joining us today. You could have been anywhere else, and you weren't. You were with us listening to Medicare for the Lazy Man podcast, and you've just spent, in case you weren't watching the clock, you've spent about 32 and a half minutes with Doug Jones, the anti-insurance insurance guy, originally from Oklahoma, where the red dirt is, but now he's up in the high ground behind Cave Creek, Arizona, in the Nosebleed Mountains. And there's no red dirt up there that I know of, so I don't know
Rocks.
whether rocks. There's lots of rocks. Are
Yeah.
they red? Are they red rocks?
They're volcanic rocks that break
They're
apart when you grab them.
They're volcanic rocks. So anyway, I always measure, because he's in the Nosebleed Mountains, the home of the Nosebleed Indians. I always measure how high he is before we start the podcast so that I can tell him before he ends how high he really is.
Police officers have a method of doing that too, but Randy's method
So,
is different. It's
so
more
anyway,
cerebral.
here we go. He's at 8,200 feet. That's where he's at.
That's where I've been for a while now. And
Yeah.
frankly, I don't mind it. It's such a beautiful day out there that 8,200 feet is okay with me. And frankly, you audience members are also okay with me. I'm so happy to have you with us every episode. And I'm looking forward to having you join us again for our upcoming episode in just a short while. So until I see you then, bye bye.